I'm John Taylor. I had a heart attack in 1989, which meant I had 5 bypasses done. 8 years later I had to have 4 of those redone, and 8 years after that I had to have some stents put in. In between I had blockage to my left kidney artery, and that had to be replaced in a bypass. So I have quite a convoluted medical history, and I also take quite a lot of medication. So every time I go to hospital I have to go through explaining to junior doctors and nurses and A&E and consultants exactly what's happened, and then someone else comes along, I have to explain it all again and again and again. Where if it was available electronically wherever I was in the country, it would be available immediately and would speed up diagnosis and treatment for me. I went in our local hospital through A&E, had to go on to the assessment wards, and the first thing they said was, sorry, we don't know where your records are. So my medical records were not available because one hospital thought they were at another hospital, the other hospital thought they were somewhere else, and it actually took 2 days to get hold of my records. If they were available in a sharing system, then that wouldn't have happened. As it happened, there were no severe consequences, but on another occasion maybe there would be. Every time we see a new health professional, we've got to go through all the details again, and that is taking up time that could be used for other things. If the health professional that I'm seeing was able to look at the information 5 minutes before I went in to see them, then we would have a full-time consultation without having to waste time going through all these details. And quite a lot of people, and I must admit I'm one of them, can't remember the names of everything, every medication they're on each time, particularly when, like me, they're on quite a number of medications. Well, initially the Summary Care record is actually a very basic record that will only have a small amount of information about my conditions on it, such as the medications I have and the allergies that I have, and also of course my name and address and my doctor's numbers. But over a period of time, as it gets more information into it, then it will produce a full record which won't be lost somewhere in a dusty room. I know that I am opted into this system unless I actually take steps to get out of it, and personally I can't see any sensible reason to opt out of this system. For example, if I was taken to hospital unconscious, I would most certainly want the people there to know what my history was and to be able to treat me accordingly. No one knows, no matter how good their health is, what's going to happen when they walk out. One of the things that we do as a family is we holiday with a touring caravan. So quite often we're in the middle of nowhere, and although the ambulance services would get me to the nearest A&E department if something happened, they would not have my records, and my records could literally be 300 miles away. And what are they going to do? Put them in a taxi and send them down? Or far better would be that if they were instantly available in an electronic storage system. It's not yet happened to me, but I have it at the back of my mind all the time. What if? When I need medical care, the last thing that's on my mind is worrying about who's going to have access. I want the people who need the access to be able to get it, and I'm not really bothered the other way. I have sufficient trust in the systems within the health service and the professional standards of the people there to know that it's not going to be misused. Certainly I have far more confidence in the security of my records in the National Health Service than I have with many of the records that I know are kept on other databases. And I certainly know that the National Health Service won't be selling my information.